Before we jump into today's conversation, I just want to make sure we give a quick shout out. This whole discussion is brought to you by the Blossom TMS team over at www.blossomtms.com. So if you're a provider who's looking to elevate your practice with some really advanced technology, they are absolutely the ones to check out. Now, let's get into it.
Let's do it.
I want to start with a scenario that I think everyone listening is going to recognize immediately.
Okay.
You've got the clinic. You have the technology. The chair is right there. You've got the expertise. And then you hit this wall. A patient comes in. They are a perfect candidate for TMS. They're suffering. Meds aren't working. They clearly need this. But then they hesitate. Or, even worse, they just walk away.
It's that classic drop-off point, and it's so frustrating for providers because, you feel like you have the exact tool that could help them, but you just can't quite bridge that gap to get them into the chair.
Exactly. And that gap is what we're unpacking today. We're looking at this really fascinating piece of material. It's titled Educating Patients for Success in PMS Therapy. And the core argument is, well, it's actually pretty surprising. It basically says we tend to treat patient education as this extra thing, like it's marketing or just some supplemental reading. But this source argues that education is actually the central engine of clinical success.
It's a complete reframing. The whole premise here isn't that you just need a better brochure to, sell more treatments. The premise is that the education is the treatment, or at least it's the foundation of it. It's integral to informed consent, to the therapeutic alliance. If you're looking at education as just marketing, you've already lost the plot.
And I want to be really clear for everyone listening. We know you're not new to this. You know what TMS is. You know the mechanism of action. We aren't here to explain how a magnetic field works.
Right.
We're here to talk about how you explain that to a patient who is maybe scared or confused or skeptical to make sure they actually buy into the process.
Exactly. This is about communication strategy as a clinical tool.
So let's start there with this concept of the bridge. The source calls patient education the bridge between clinical expertise and patient decision-making. Why is that bridge so specifically necessary for TMS? I mean, we don't need a huge educational bridge to get someone to take an aspirin.
That's a great comparison. But think about the difference in the patient's experience. If you prescribe a medication, they go home, they take a pill, it's private, it's familiar, even talk therapy, it's a known quantity in our culture. But TMS, this involves advanced technology. It involves a machine, interacting directly with your brain. That is a massive conceptual leap for a patient to make.
It sounds like science fiction to a lot of people.
Precisely. And the source highlights that patients are often coming to TMS after failing other treatments. So they're vulnerable, maybe a bit cynical, and now you're introducing this, quote, brain stimulation device. The source says clinics have to proactively address that fear or misconception. If you don't build that bridge, the patient is just stuck on one side with all their anxiety, and you're on the other with your science, and there's just no way across.
I love that image. And the source mentions one of the biggest hurdles is just the intimidation factor of the tech itself.
It creates a huge psychological barrier. The source notes that they're often encountering this as an alternative to meds or psychotherapy. They have a frame of reference for those. They have zero frame of reference for sitting in a chair and having magnetic pulses delivered to their, dorsolateral prefrontal cortex.
So the goal of education here, and this is a key distinction, it isn't just information transfer. It's not about just dumping facts on them.
No, and that's where a lot of providers can get it wrong. The goal, like the text outlines, is setting realistic expectations. It's about outcomes and timelines and safety. But I think more importantly, it's about demystification. When you explain the mechanism clearly, you're not just teaching. You are signaling transparency.
Transparency is a big word here.
It is. The source makes a really profound point here. Clear education shifts the entire dynamic. It stops looking like a clinic that's trying to sell a fancy procedure, and it starts looking like a medical provider who's offering a clear, structured, clinical pathway. It just professionalizes the offering in the patient's eyes.
That makes perfect sense. If you're hiding the details, it feels like a sales pitch.
Right.
But if you're putting it all on the table, it feels like medicine.
Exactly.
Okay, so we buy the concept. We need a bridge.
Right.
But let's get practical. What is this bridge built out of? The source goes into what I'm calling the stack of educational materials. It's not just one thing.
Oh, it's definitely not just a trifold brochure in the waiting room. The source describes a layered approach. You start with what it calls foundational content. This is the bedrock.
Which is what? The TMS 101?
Essentially, yes.
Yeah.
The source lists the absolute non-negotiables, how it works, the conditions treated, and this is crucial session duration, but there's a specific detail in there that I think is really smart, explaining what a typical session looks like.
So walking them through the actual experience.
Right. Not the magnetic physics, but the sensory experience. Will it hurt? What does the chair feel like? Can I drive myself home? This kind of content, it usually lives on the website or in a downloadable guide. The source argues clinics that invest here see fewer drop-offs because the patients coming into the consult already know the basics.
So you aren't spending your valuable consult time explaining what the acronym stands for.
Exactly. You get to have a much higher level conversation from the start.
Then there's the next layer, which gets into the friction points, the FAQ layer. I found this part really interesting because it's all about what stops a patient from saying yes.
The silent objections, and the source is very specific here. You need to address safety and side effects, obviously, but also, the sensations during treatment, that tapping feeling. Compatibility with medications is another big one it mentions.
And the elephant in the room, insurance.
The big one. The source explicitly lists insurance coverage and eligibility as a necessary topic. If a patient is just sitting there worrying about whether they can afford this, they're not hearing your clinical advice. The source suggests answering these questions before the patient even has to ask. It reduces that feeling of overwhelm.
It's proactive objection handling, really.
In a way, yes, but clinically, it's anxiety reduction.
Then we have the visual element. The source puts a lot of weight on visual and step-by-step educational tools. Why is that so critical for TMS?
Because for many people, seeing is believing, but for TMS, I think seeing is calming. The text mentions things like diagrams of coil placement, session timelines, progress charts. Think about the psychology here. If I show you a diagram of exactly where the coil goes and a chart of how treatment progresses over 6 weeks, what am I communicating?
You're communicating that you have a plan, that this isn't random.
You're communicating that this is structured, repeatable, and clinically controlled. The source notes that visuals reinforce that this isn't some experimental Wild West procedure. It's a precise medical intervention. And that visual structure, it really soothes the anxiety about new therapies.
It grounds it, takes it from the abstract brainwaves to a concrete, here's the schedule.
Precisely. And that structure creates a sense of safety.
So we have the content, we have the stack. Now, where does it live? Because the source has some strong opinions on workflow. It seems like the old way was, the marketing department handles the website and the doctors handle the care. But this argues for integration.
Blending is the word it uses. And the advice here is that you shouldn't separate your marketing from your education. The source suggests embedding that educational content directly into your service pages. Don't make them click away to a blog to learn how it works. Put the explanation right next to the book appointment button.
That makes for a smoother experience for sure. But there's a workflow hack in here that I think every clinician listening should really pay attention to. The pre-consultation tool.
This is where it gets really efficient. The source suggests using all this education as a pre-consultation requirement, or at least a strong nudge. You send the materials to them before the intake.
So the patient does their homework.
And it changes the entire texture of that first meeting. Instead of the doctor spending 20 minutes on the basics, the patient arrives having reviewed the materials. So now the conversation shifts from what is this machine to how will this help my specific depression? It personalizes the care immediately. And frankly, it respects the clinician's time.
I love that. It just elevates the whole consultation.
Yeah.
But here's a nuance that surprised me. The source says education doesn't stop when the treatment starts. I kind of assumed once they're in the chair, the selling is done.
And that's a dangerous assumption to make. The source really emphasizes referencing educational concepts during milestone sessions or progress reviews. Remember, TMS is a commitment. It's weeks of treatment. Patients can get fatigued. They can wonder if it's even working.
So you use the education to keep them engaged in the process.
You use it to reinforce the timeline. You say, remember, we discussed that around week 3, you might start to feel X. It keeps them tethered to the process. It's not about selling anymore. It's about adherence.
Which leads us perfectly into the ROI.
Yeah.
Because we have to ask, so what? On the business side of things, we're talking to clinic owners, to busy providers. Why should they invest time in building all these diagrams and FAQs?
Well, the operational benefits are pretty hard to ignore. The source is clear. Well-informed patients are just more likely to start treatment. That's your conversion rate right there. But, maybe more importantly, they are more likely to adhere to protocols and complete the full course.
Which is better for them clinically and better for the clinic's revenue.
It's a true win-win. But there's a deeper ROI mentioned in the text that I think appeals to the ethical side of the practice. It talks about shifting the dynamic from persuasion to partnership.
Persuasion to partnership. I underlined that twice.
It's a powerful concept, isn't it? When you educate thoroughly, you're not trying to talk someone into a procedure, you are inviting them to understand an option. The source says this really aligns with patient-centered practice. You're treating the patient as an intellectual equal in their own recovery.
And that builds trust.
It builds a stronger therapeutic alliance. And in a field like mental health, that alliance is often half the battle. If the patient trusts you're being transparent, they're much more resilient when treatment gets tough or if results are maybe slow to appear.
Plus, let's be honest about the market. It's getting more competitive. There are more TMS providers popping up.
That's the final point on ROI. Differentiation. The source argues that in a crowded landscape, the clinic that articulates its approach clearly is the one that stands out. I mean, if Clinic A has a confusing website and Clinic B has a clear, visual, step-by-step educational pathway, who do you trust with your brain?
Clinic B, every single time. It just feels safer.
Exactly. It reduces unrealistic expectations, which protects your reputation, and it attracts the kind of informed patients you actually want to treat.
So if we try to summarize what we've uncovered here, we started with this idea of education as just marketing fluff, and we've ended up seeing it as the operating system for the entire patient journey.
It really is. It's the mechanism that turns a curious browser on your website into a committed partner in their own recovery. It's all about safety, efficiency, and at the end of the day, better clinical outcomes.
And for the providers listening, it really sounds like an audit is in order. Go look at your materials. Are they building a bridge or are they just a wall of text?
And ask yourself this: are you answering the questions the patient is actually afraid to ask?
That is the key. Now, before we wrap up, I want to leave our listeners with one final thought to chew on. We've talked a lot about efficiency and adherence, but there's a deeper question here about the philosophy of care.
I think the provocative question here really boils down to power dynamics. If trust is the absolute foundation of mental health care, take a hard look at your current educational material. Is it designed to treat your patient as a partner, as someone who is capable of understanding complex medical decisions? Or is it treating them as a passive consumer of a service? Because the difference between those two approaches, that might just be the difference between a patient who drops out and a patient who actually gets better.
That is a powerful place to leave it. Are you building partners or just customers? A huge thank you for breaking all this down with me today.
Always a pleasure.
And a quick reminder to check out the Blossom TMS Therapy System by Siebers Medical at www.blossomtms.com. They're doing some incredible work aligning their technology with this exact education-first approach. Thank you all for listening. We'll catch you on the next one.